child is vaping, how can I help my child quit vaping, Vikram? And I don't know if Michael Burke is around, but Vikram, can we start with you?
Yeah, so I think the first thing, if your child is vaping, is to really understand why they're vaping, and to understand, how much and those things. And I think that, in the same way that we train healthcare workers to ask those questions, it can start much earlier as well. So kind of understanding, why your child is vaping, if they're vaping, how much they're vaping, because, vaping may be in response to stress and anxiety. It may be because of peer influence. It may be because of thrill seeking and experimenting. They may think it's harmless, or, if they're vaping a lot, it could be due to addiction. And all of those different reasons kind of have different responses that will work better. And so I found that, if your child has an underlying mental health condition, anxiety, low mood, and they use vaping to help because they get that instant nicotine hit and they feel calm, we need to address that underlying mental health anxiety and issue before we'll get a significant response to trying to stop the vaping. And I've found that, young people often have really limited insight of how much they use, and compared to, the cigarette example, for instance. So that's a good hook in terms of comparing their use versus the comparison, which might be 1 or 2 packets of cigarette, and the harm that that's doing. And yeah, really trying to find out the reasons why they're vaping. And it might just be that they're experimenting, or it might be peer influence, and then that's something that you can target as well. And certainly kids who are addicted to vaping or vaping a lot, there's a lot of resources and clinics and other services available in the community. One that I've been familiar with is the Cicada service at Westmead Children's Hospital, and there's professionals there in order to respond to that. Kids who are addicted to vaping and on the more risky use of vaping. But yeah, I think the main thing is to really open that communication and think about why your child may be vaping in the first place.
Thank you, Vikram. And unfortunately, Michael Burke, our GP, is not here today. But mainly, one of the things we also encourage, if your child is having that problem, first of all, go and see your local general practitioner. He or she will be able to get help, and we are going to be working with our local doctors to ensure that they do have support services and are able to refer both yourself and your child to appropriate services.